and begin tonight. I think folks will join as we get going, but we'll go ahead and start. Thank you so much to everyone for coming here on this beautiful summer evening. We really appreciate your time. I'm going to introduce our moderator for tonight's webinar, who is Lucy Hodder. She is a professor of law and director of health law and policy programs for the UNH Franklin Pierce School of Law. She'll be introducing Dr. Limaye tonight and moderating our Q&A segment. So Lucy, I will pass it over to you.
Wonderful. Thank you, everybody. It's great to see everyone. And we are just absolutely thrilled to have Dr. Vijay Limaye here tonight to talk to us about the impacts of climate change and the costs. He's an epidemiologist and senior scientist at the Natural Resource Defense Council, focused on climate and health science. Vijay is broadly interested in addressing international environmental health challenges and quantifying, communicating, and reducing risks associated with climate change. I think air pollution and extreme heat are his focus areas, and just coming from a presentation I did in Phoenix, Arizona, I can say that extreme heat is a real threat and danger in many places, even this country. And his research seeks to value and advocate the significant health costs of climate change. Health costs are something that is near and dear to my heart in terms of addressing with our health system and just the impact of climate change. We're going to hear from him how to quantify, how to communicate about, and how to advocate change. He's also worked at the EPA on Clean Air Act regulation, speaks Spanish and Hindi, and is here to talk to us for about 45 minutes, at which point we will be able to have a bit of a free-for-all and also somewhat moderated discussion. So put your questions in the chat or indicate that you have a question, and I'll call on you so we can make sure we get everyone's issues addressed. This event, we are so lucky to have it co-sponsored by the New Hampshire Public Health Association and the New Hampshire Medical Society, who are both incredibly vested in communicating about climate change. So we turn it over to you, Dr. Limaye. Thank you so much for joining us and giving us your time.
Great. Really appreciate the invitation. I've been seeing all of the awesome speakers in your lineup over the past few months and the weeks ahead, and really am really humbled to be part of that group and grateful for the invitation. So yeah, I'll just kind of dive right into my talk. Hopefully you can see the slides okay, and happy to leave plenty of time for robust back and forth and hear your perspectives on this work, which I'll just say is a work in progress very much on our side, and so welcome input from all of you. Great. Okay, so yeah, just to elaborate a little bit on NRDC, I think a lot of you probably know of us. The Natural Resources Defense Council is one of the oldest and most effective environmental advocacy nonprofits in the US. So our peer institutions are folks like the Sierra Club, Environmental Defense Fund, Earth Justice, et cetera. NRDC has been around for 52 years. We're about 700 staff strong, both in the US as well as internationally. And I'll touch hopefully a little bit on some of the work that I'm up to on this topic in India. So I'm part of NRDC's science office, and I work with Dr. Kim Knowlton, who some of you might have known, who's been working really on climate change and health for about 15 years at NRDC. And I'm kind of, the two of us are kind of the climate and health brain trust within NRDC, working on both domestic and US issues when it comes to this economic valuation project, as well as a suite of other projects. So really excited to share some of our work with you all. This is a group that's, of course, very familiar with the current situation, the unprecedented situation that we face across the country and around the world. Just to give you a sense of what our federal government is doing currently to kind of track the impact of climate and weather disasters. Some of you might have heard of this $1 billion disaster list. It's an effort run by NOAA, the folks at the National Oceanic and Atmospheric Administration, the folks that house the Weather Service. Since 1981, NOAA has been tracking the financial impacts of the costliest climate and weather disasters across the country. So the disasters that reach or exceed about $1 billion in damage to property, crops, and infrastructure. So every quarter, every 3 months, NOAA publishes its latest assessment of the impacts of both climate and weather disasters. And just right up top, I want to acknowledge that this talk is really focused on climate sensitive impacts. The map you see here is a little bit different. We're talking both about climate and weather disasters. So things like the extreme winter storm in 2021 in Texas, tornadoes, those events are not definitively linked to a changing climate as of yet. And so really our focus here is on a kind of a subset of what you see on the map. So flooding, wildfire risks, drought, extreme heat, stronger coastal storms, et cetera. So anyway, this map is basically the summary of the costliest climate and weather disasters that afflicted the US last year. By NOAA's estimate, the total cost from these 20 separate climate and weather events was about $145 billion. And just looking back at the 40 years of data, it's very clear, no matter how you slice it, trends are heading in the wrong direction in terms of both more, excuse me, more higher counts of climate and weather disasters over time, as well as higher economic damages. So I think all of you come to this issue of climate from a health perspective, and I look at a map like this and I wonder what's left out. If NOAA is keeping track of property damage, crop failure, wrecked infrastructure that needs to be repaired, what about the human element that's kind of left out here? This issue in terms of the costs of climate change is very much in the news. It was highlighted a few years ago in our federal government's last National Climate Assessment, the fourth National Climate Assessment, really made headlines because it pointed to the fact that towards the end of the century, we could be facing, a pretty big GDP hit from climate change, approaching 10%. The National Climate Assessment articulated hundreds of billions of dollars in economic damages linked to a changing climate just in the US, but it really didn't offer a whole lot of specificity in terms of how those costs are distributed across various categories and which populations are expected to suffer the most economic harm. So more and more, we're seeing folks kind of call attention, especially to the missing health piece here. And just to, kind of take a step back on the overall climate issue, I think, we all know that we face really a pivotal situation at the federal level over the next 2 months or so to see if lawmakers are going to follow through on a commitment to transition our country, aggressively away from fossil fuels and towards cleaner energy sources. There's been tons of coverage, right, about how much that agenda may cost. And there's been a lot of focus in terms of the dollars needed to transition our economy away from polluting fossil fuels. There's been a lot less attention to the economic toll imposed by climate change as it intensifies. And so I just want to play like a brief video clip from January of last year that really, I think, lends some needed articulation to the fact that we have a pretty short attention span in this country, and we often lose sight of the cumulative toll in terms of costs of some of these climate disasters. So I'll just play this clip from John Kerry, who's a special envoy for especially international climate negotiations.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms, Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. That last year, with one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term.
So, I think the point made there is a good one in that, we're paying a lot as taxpayers, we're paying a lot as people, 1 in 4 Americans last year affected by a climate or weather disaster. There is, money being spent to deal with the slew of damage imposed by climate and weather disasters, but we're not really doing a great job of tracking that and communicating about it. I'm not going to stress too long on this slide because I think it's probably old news to many of you. I use this moment to give gratitude to Jonathan Patz, my PhD mentor, who has been working on the issue for 25 years or so, and really called attention back. This slide is from 1998 to the various ways in which a changing Earth system, on the left side, temperature rise, sea level rise, and changes in the water cycle in terms of both prolonged extreme drought and intense rainfall events are expected to, trigger a whole range of adverse human health consequences. And I think a lot of you are probably already familiar with these details, but I just want you to kind of take a snapshot of this slide, and we'll come back to it a little bit later to talk about some findings that we uncovered through some more recent work. That's kind of the setup for our overall question, which has been to try to begin to articulate some sort of baseline in terms of what climate sensitive exposures and climate change as a whole are costing in terms of public health damage in the US. And we're certainly interested in the international component too, although the data challenges are pretty major when it comes to connecting the dots here. So this is really, motivated, I think, by the political situation in which, we hear a lot of complaining from a particular corner of the economy about how much it's going to cost to deal with climate change, and a lot less about the mounting damage that we're facing. So, like I mentioned with that NOAA map, a lot of existing climate change damage, cost estimates are pretty much confined to things that are damaged, repaired, or insured. Things like property damage, infrastructure, crop failure. Those are things for which it's relatively easy to add up the dollars and figure out how much we're paying year after year. Health costs, in contrast, have seldom been included in these types of big, think of the IPCC assessments or the National Climate Assessment. We know that climate change harms health. We know that healthcare in this country is extraordinarily expensive, but we really haven't had the tools to connect the dots and make informed economic arguments about the public health damages. NRDC has been working on this topic for about a decade. Kim Knowlton published a study with colleagues in Health Affairs back in 2011, really attempting to develop kind of a proof of concept model towards connecting climate-sensitive exposures to health harms to economic costs. And so I joined NRDC in 2017 and kind of began embarking on work to update that analysis and expand on it. So that work resulted in this peer-reviewed publication. I'm happy to share these slides after the talk, by the way, because there's a bunch of links that I'm included. We published a study back in 2019 that took advantage of what we're calling this kind of case study approach, which is basically a first attempt to select a sample of case study climate sensitive exposures across the US. We focused on a single year, 2012, and tried to do this basically tallying of health and economic damages. It's not rocket science. It's really a bit about data integration across multiple sources. So the study was published in 2019 and was focused on 2012 data, in part because it just takes quite a while, especially in the peer-reviewed literature, for these analyses to emerge. We took advantage of publicly available health data in terms of premature mortality and illnesses and injuries, and combined that information with health costing data from federal databases. The Agency for Healthcare Research and Quality, AHRQ, maintains several health economic databases. We took advantage of the Healthcare Cost Utilization Project, HCUP, as well as MEPS, Medical Expenditure Panel Survey, to basically connect the dots and establish some baseline. So the idea here is distinct from climate change attribution, which would be like, parsing out the specific attributable portion of health harms and costs attributable to the change in climate specifically. This is more just about establishing the baseline, for which we really, lack information about the current incidence trends across the country. So I mentioned the year 2012. This animation depicts the kind of menu of our overall case study set. So here we're relying on the science that's summarized in the National Climate Assessment and various IPCC reports, focusing on different climate sensitive exposures. So we looked basically across the country to select a wide range of exposure types, a wide range of geographies, and took advantage of a number of publicly available data sources on the health side to basically try to gather as much data as we could on the health harms inflicted by each of these types of exposures. So, we're talking about wildfire, harms directly, injuries, et cetera, as well as the harms from wildfire smoke experienced in 2 states. We looked at my home state in Wisconsin for an extreme heat event that occurred in July 2012. Vector-borne diseases, including Lyme disease, West Nile virus, are linked to a changing climate. It's a complicated story there, of course, in terms of changing, vector ecology, et cetera. So, a bunch of caveats kind of rolled up in this analysis, but I'll just, kind of leave you with this map to give you a sense of the overall scope that we were delving into. We looked at Hurricane Sandy in just 2 states, New Jersey and New York, to kind of constrain the analysis a little bit. And I'll just say that even as we collected publicly available data in gathering evidence for the study, evidence continues to pile up even for 2012 harms. So this was not by any means an attempt to comprehensively tally like nationwide what was happening, really more of a kind of sample of what was happening in 1 year, just to give us a sense of the kind of ballpark figures we're dealing with. So when we talk about health costs, these kind of fall into these 6 bins you can think of. In terms of deaths, the Environmental Protection Agency, my former employer, is routinely engaged in regulatory impact analyses that attach economic value to avoided premature mortality through a metric some of you might know called the value of a statistical life. It's a somewhat, I guess, controversial metric out in the health economic literature, but it's one in which our federal government has kind of allowed for a specific dollar value to be placed. So we're not talking about the value of human life. We're talking about the value that people in surveys place on incremental reductions in mortality risks. I'm not a health economist, but Wendy Max at the University of California, San Francisco was our main health economist collaborator on this project. For everything else here, all the morbidity costing, we really relied on those 2 AHRQ databases. The idea here, just kind of in the narrative, is to think not just about the most severe impacts from these events, but to take the longer view. The news cameras during a wildfire or a hurricane often, pack up and leave town a day or 2 after the event. We know that people are continuing to experience physical and mental anguish after climate-sensitive exposures. And so we were trying to use the available data to connect the dots, do a little bit of data imputation to arrive at a fuller picture of the kind of cumulative toll over a longer time span. So for example, we looked into mental health harms experienced in 3 or 4 months after Hurricane Sandy, not just like kind of the direct mortality burden of that event. I'll just mention that the vast majority of research on this topic has focused on premature mortality, again, because obviously that's easier to count. We were really looking to shine a little bit of light on the morbidity burden, especially understanding that more than 1 in 3 Americans right now experience medical financial hardship, which means that they are delaying or completely foregoing necessary medical care, which can make them even more vulnerable to additional harms from future climate related exposures. So this is the overall kind of view of what we were trying to tally in terms of health costs. I mentioned our searching through publicly available data sources. And one of the big take homes from my talk, I hope, is that we really have a disjointed, scattered data surveillance situation across the country when it comes to monitoring climate change and health impacts. This table really depicts the 36 or so data sources that we relied on, largely peer-reviewed literature, but also reports from state and local health departments, as well as incidence data collected by federal partners at CDC, EPA, and NOAA. So, we really do not right now, of course, have a unified, coordinated clearinghouse for climate and health data. And so that's, a big problem when it comes to trying to begin to understand the current scope of the problem, much less think about what it means into the future. And we came up with a few recommendations on that front that I'll speak to a little bit later. Just to give you a peek under the hood at our model, this is kind of the flow chart that depicts how we connected health data depicted in the yellow boxes with all of the economic costing data. So that's the green box for the premature mortality costs, as well as the blue boxes for all of the morbidity data. I'll just also mention here that lost wages were part of our analyses. We were able to take advantage of hospital admission length of stay data from HCUP to estimate, if folks are away from work while they're recovering from a health problem, incorporating those costs as well. So it was really kind of combining all of the health incidence data with the health, economic database information from AHRQ to arrive at these total health-related costs. So this is where we kind of have the corollary to Jonathan Patz's 1998 figure, right? Because that was, really kind of a broad, high-level bird's eye view of climate change impacts on human health. This is the list that we arrived at from our data collection, spent probably about a year collecting data from those several dozen data sources. This is, the type of information that we right now do not catalog adequately. Each of the health effects included on the rightmost column on this table, we were relying on ICD, International Classification of Disease, coding within each of these studies to basically pick out specific health effects and then tie them to the economic data that we had. So I'll just, point to the fact that I think a lot of us think about climate change and health. A lot of people out in the public think about maybe extreme heat, or they think about a stronger hurricane or a wildfire risk. They may not be thinking about things like pregnancy complications in Hurricane Sandy, or the long-term implications of exposure to, contaminated air and wildfire smoke, which can include traditional air pollutants like fine particulate matter and ozone, as well as a suite of toxic compounds, lead, manganese, et cetera, that we don't adequately monitor and for which the epidemiology literature is relatively thin. So as a former EPA scientist, I was interested to shed light on some of these kind of lesser studied health harms from climate sensitive events. I mentioned the mental health burden of Hurricane Sandy, as well as deaths from end-stage renal disease. When the power went out during Sandy in New Jersey and New York, we of course had complications for people receiving dialysis, et cetera. Neil Fan at EPA, a former colleague, has done fantastic work on wildfires. We're getting better at isolating the wildfire smoke contribution to air quality impairment across the country. Probably in New Hampshire, even if there haven't been fires burning in the east, certainly where I am in the middle of the country, we've seen, late summer is pretty routine at this point to see air quality impairment linked to wildfires burning out west. So, we were really trying to kind of also support federal efforts that are happening to shed light on some of these lesser studied effects. I'll just say that, I work a lot on air pollution policy at the federal level. It's very clear that wildfire smoke problem is pretty much overwhelming a lot of the recent gains that we've made through the Clean Air Act. Wildfire smoke events are basically set aside as exceptional events when it comes to EPA decision-making around attainment of the Clean Air Act standards, health-based standards right now. So we really face a really challenging situation when it comes to wildfire smoke because it's not adequately kind of incorporated into the legal framework of the Clean Air Act due to the exceptional events rule. So I'll just say that, as much as we were able to compile that kind of grim listing, cataloging of all the health problems, it's clear that, the evidence is growing day by day. A lot of you are probably involved in some of that research, epidemiology studies, et cetera, to implicate climate change and additional health harms that we, just didn't uncover because of the lack of data. So with that long preamble, I'll just give you kind of the take-home numbers from the study. When you add up all of our case study states, you end up with more than 900 deaths, more than 20,000 hospital admissions, and close to 18,000 emergency department visits across the country. Of course, there's wide variation between states. Of course, something like Lyme disease is almost never fatal, but we were interested in kind of articulating state to state what was happening, and also, thinking about how healthcare systems are prepared or not to deal with onslaught of patients from a problem like wildfire smoke, et cetera. So this is the take-home, kind of health numbers. And when you attach the economic valuation to that using the federal database, you end up with, on the lower right here, somewhere around a $10 billion price tag. That's, split with a dominant share devoted to the premature mortality burden, which is consistent with the other research that's out there on this topic. But, more than $1.5 billion just in this small case study set related to illness care in emergency rooms and hospitals. And so we were, particularly interested in that $1.6 billion figure because it's kind of, lesser studied. We have that kind of metric for something like heat-related exposures, but we really are still grasping to establish a baseline here when it comes to illnesses and injuries related to some of these other exposures. When it comes to that $1.6 billion, I think the logical question is, well, who's actually paying that money, right? By our best estimate, using the limitations of the available data, a disproportionate share of the illness burden was shouldered by Medicare and Medicaid patients, which unfortunately aligns with our scientific understanding that these folks, the economically marginalized older folks, are on the kind of being hit first and worst by climate change harms. We also are, interested in working with, folks at Medicare and Medicaid. We've been talking to both public and private insurers at the federal and state level to, continue this work to delve more deeply at this kind of who pays question. Here, I'll just kind of signal to the fact that we are also exploring the international implications of the inequitable burdens when it comes to costing. I published a commentary a few months back pointing to kind of the overlap between globally around the world, exposure risks from climate hazards, health vulnerabilities in terms of pre-existing conditions, and lack of access to affordable care. That are compounding to impose higher burdens on already marginalized groups. So it's something that we're interested in exploring and still seeking out some more international partners on this topic. So when it comes to the take-home policy recommendations, I don't think any of these will surprise you given your interest in the topic of climate and health. Of course, what we need to do first is rapidly transition our economy away from coal, oil, and gas. That's making this problem worse. But at the same time, NRDC is increasingly engaged in the climate adaptation space, thinking about ways to keep people out of harm's way in terms of the climate harms that we know are coming, thinking about improving health preparedness, thinking about incentivizing health insurers to take proactive actions with their customers to hopefully avoid their own kind of cost hit. And we also need, much better, much more comprehensive, much more robust cost estimates than just this one study. And that's happening, but not nearly at the pace or scale that we need it to. We also are, increasingly engaged in the federal space in advocacy around improved health surveillance and tracking that I'll mention in a second. So, overall, we're continuing to see large, authoritative reports like the Lancet Countdown, which is doing fantastic work, draw attention in general terms to the health-related costs of fossil fuels, both in terms of air pollution as well as these other harms. But pointing out the fact that, as this first study from NRDC was 11 years ago. The study I led was 3 years ago. We're still not seeing that kind of momentum build enough towards kind of a national assessment that's more comprehensive. In our work, we did make an attempt to try to signal sort of what's still on the table in terms of economic damages that we could quantify. This figure basically depicts the portion that of health harms and costs that we accounted for in our study. So each of these columns is a proportional representation. The blue section is the proportion of health harms captured in our 2019 study, and the yellow hashing represents the known health burden that we didn't account for in our work. So you can see that for a problem like Lyme disease in Michigan, we were talking about somewhere around 1 or 2% of the health burden nationally. And of course, Lyme is a complicated situation. But even for something like wildfire smoke, it's very clear that this is now not just a local or a regional problem, but it's really a national and really international air quality problem and health problem. And so we need a lot more attention to some of these issues for which we have much less comprehensive tracking. I mentioned attribution at the top of my talk, and I do want to really acknowledge that there's fantastic advances being made on both climate attribution science and relating it to public health. So this is a graph that was published in a study about a year ago, pointing to kind of the idea here is that we could basically construct a counterfactual situation. The orange line here would be our temperature trend if we did not have human-caused climate change. We compare these kind of two situations, our actual situation on the red line and this counterfactual, and compare kind of the burden of heat-related mortality under those two different scenarios. This study from Nature Climate Change was pretty eye-popping in its result, implicating climate warming specifically in more than a third, 37% of heat-related mortality globally between 1991 and 2018 linked to climate change. Reporters ask me all the time during extreme heat events or other climate events, well, how much worse was the health burden due to climate change? We've already, we would have had heat waves anyway, we would have had hurricanes anyway. And this is one of the first studies of its kind that I can point to using data not just from the US, but from 43 countries here, really kind of doing a careful analysis to begin to tease out the incremental portion and contribution of climate change. I will say, though, that as much as we would like attribution science to proceed as rapidly as possible, I think if we wait for the quantitative certainty around attribution to climate-related health harms, we'll be waiting a long time. And meanwhile, the problem will be intensifying rapidly. So I think we need to balance the scientific inquiry here with our very robust understanding of health harms related to greenhouse gas emissions. I mentioned, all the science that continues to emerge. This is just like kind of the extreme heat studies that have come out over the past year or so, implicating extreme heat in additional problems and additional populations of concern, outdoor workers, mental health problems, children, kidney stones. For anyone like me who has suffered a kidney stone, seeing that study was particularly alarming. So I think one of the challenges here is just to keep up with the thankfully growing literature around climate change and health impacts and incorporate that knowledge and understanding into our costing studies as much as we can. Towards that end, since you are all healthcare professionals, I wanted to draw attention to some work that Vijay Limaye out at University of Colorado and Stefan Wheat, one of his climate and medicine fellows, and I have been working on to try to articulate to health professionals the ways in which our existing ICD coding system, which is admittedly set up for medical billing, could be repositioned or at least utilized to help support some of this costing analyses. Right now, we're kind of relying on ICD coding as the key to unlocking these economic assessments. And so we're really reliant on the data that we get from folks like you on charts to make sense of. And so if we don't have adequate accounting of heat-related illness, for example, through an ICD coding system, we really can't account for that all the way through to the costing work. So I encourage you to check out, this was a blog we put up on the Health Affairs site a few months ago, and we're continuing to kind of actively think about ways in which we might take advantage of improved medical coding to improve our understanding in the US at least. We've also been, trying to engage more just on the kind of commentary space on the ways in which these cost estimates can help to articulate the extent of damages imposed by climate change, but also kind of flipping the script and thinking about ways in which, our understanding of the benefits of climate change adaptation, for example, can be informed by economic assessments. So, if someone asks, well, how much money is it going to take to run a cooling center or implement cool roofs or take advantage of a new early warning system for wildfires, we would ideally be able to come back with some information about the avoided health harms and the associated economic benefits. And this is a commentary in Health Affairs also from a few years ago that we spoke to on that topic. So I'm kind of wrapping up here, but the overall kind of goal here is being able to pair kind of this retrospective analyses that we did with more of a forward-looking investigation. So, in Wisconsin, for example, there's fantastic work happening in the academic space to think about, downscaling climate models and think about future heat burdens. The idea, I think, long-term for us is that once we begin to arrive at more robust cost estimates, we could be able to think more clearly into the future in terms of what kind of cost we face under different climate change action scenarios, like a low ambition scenario versus more rapid, intense transition away from fossil fuels. We're also hoping to, take advantage of the moment. I think the COVID situation, the pandemic in this country has really shown a hard light on CDC, of course. The agency has been relying on fax machine printouts, emailed spreadsheets, recordable CDs to track the movement of a deadly pathogen. A 1980s technology that, is basically obsolete is being used at the highest levels of our federal government. And so we're really relying on journalists at The Atlantic, at the New York Times, at the Washington Post to come up with, apples to apples case counts, death counts, et cetera. It's really, I think, kind of shameful that we've allowed public health data surveillance in this country to decay to such a point that CDC is working with such, limited tools, to say nothing of, the staff shortages. That said, we have seen CDC, even just this week, improve tools like its heat and health tracker that some of you might be familiar with. This is implemented through CDC's small but robust climate and health program. The health tracker, you'll see in that bottom right figure, is actually right now reporting daily hospitalization rates across the country in the 10 HHS regions for heat-related illness. So you can, go back and look at yesterday, June 8th, and pull up the number for your HHS region. So we're slowly beginning to, I think, assemble the puzzle pieces necessary to understand what's happening on the ground and then use that to inform advocacy. But unfortunately, I think there's just so much more work to do on this front. I think ideally, we would be able to kind of institutionalize these types of more rapid analyses. So last summer, the New York Times in August published its own analysis of excess mortality experienced in the heat dome event in Oregon and Washington that happened in June 2021. So again, we're relying on the kind of resourcefulness of journalists to track down excess mortality data. This shouldn't be a situation in which we kind of just rely on journalistic kind of investigations. We really should have much more proactive, robust public, reporting of health data in these situations so we can improve decision-making in real time. I'll just say that, we're continuing to, try to engage with groups like yours to continue beating the drum about climate change as the most profound public health challenge that we face. I'm trying to use the economic argument as well as all the accumulating science to talk about climate change as relates to public health as much as possible. And so, just want to put a few examples up here. This is some public writing we've done. The economic valuation study, we think, had the benefit of, localizing the story. So it wasn't just about international or national impacts, but it was more about, impacts in people's backyards that could help to hopefully make this issue more tangible and relatable for people. We've also seen, I think, preliminary indications that there's interest in doing more on this type of topic. The Wisconsin Governor's Task Force report on climate kind of called out the economic angle of this challenge here. And I think we're seeing more and more interest, especially from governors' offices, in doing kind of more localized but comprehensive climate health costing assessments. I'm just going to wrap up with a few final slides kind of pointing to some other work that we're doing on the topic. One is around how we teach climate change and health. I'm really interested in education about the topic because I kind of stumbled into this topic through my experiences at EPA and as an undergraduate. Right now, we don't have, of course, like comprehensive teaching of climate change as a health problem across the country, right? We have lots of local control of educational curriculum, and climate change is often taught as something that's, a problem about polar bears or glaciers or solar panels, not about people, right? And so we've been thinking about ways in which we could kind of develop a parallel level of kind of climate and health literacy elements that could help to eventually inform curriculum development on this topic, because we know that we're going to need a workforce that is prepared to confront climate change related health problems from any number of angles. And we still, of course, really lack the workforce training needed to make that happen. And then I'll just wrap up with one more article that I want to draw your attention to, that Jonathan Patz and I, along with our colleague Valerie Still, published in 2020, really kind of drawing the economic argument at a high level to talk about energy, food, and transportation systems, and specifically talk about benefits of climate change mitigation and adaptation in those sectors in terms of health and economic savings. So, I think this topic, I think all of can be really challenging mentally to work on day to day. Thinking about, the urgency of securing a livable future for all of humanity is a heavy topic. When I talk to students, I often try to transport them back to New York City in 1966, a skyline that looks unfamiliar to many of them, and talk about the ways in which we've already as a country taken advantage of science and law to make huge gains. This picture of New York is pretty much unrecognizable, thank God, right? And that's because the Clean Air Act, probably the most important environmental health law that we have in the country, has helped to achieve more than $2 trillion in economic benefits, outweighing implementation costs by a factor of more than 30 to 1. And so I think the idea behind some of this work that I shared with you today is that we can make a similar, argument and achievement on climate change, that action now, careful deployment of mitigation and adaptation in an equitable way could help us to avoid, limitless, profound suffering and billions of dollars in economic damages annually in the years to come. So with that, hopefully I've left, a little bit good. We have a good amount of time for Q&A, and I see my chat bubble lighting up with a lot of good chats here. So with that, I'm just going to leave my contact information up here. I welcome you to check out blogs that I write pretty regularly, and follow me on Twitter if you're on there too. With that, thank you, and I look forward to our Q&A.
Wonderful, and thank you so much for this incredible conversation. I'm wondering if Emily can put your contact information in the chat so we can all share it.
Sure.
We have so many questions coming in, and I'm happy to have anybody, now that we have the screen off, just raise their hand and yell it out. But one of the questions was, what can be done on the state level? And is there local sort of legislative efforts? It sounds like you're pointing towards executive branch efforts to really study the impact. Last time we had a really comprehensive study in New Hampshire was almost a decade ago.
Okay.
What can health professionals do to make the suggestion for that kind of effort, and where can we look?
Yeah, that's a good question. We've talked to some state and local health departments in Michigan, around the Midwest largely, as well as in New York, about the ways in which, perhaps development of new tools. We're not talking about, perfect, precise estimates of economic damage, but I think if people had a better understanding of, the health harms that we know are occurring, and had a bit, better understanding of trends, and kind of paired maybe information from folks like Climate Central and Climate Nexus that are doing the types of localized projections of what extreme heat might look like in New Hampshire or Wisconsin or wherever. I think it's about kind of integration, to think not just we can look back at 2012, okay, that was a decade ago, and it now seems like ancient history, right? And so I think we would like to see and support like tool development for state and local health departments that could allow them to take advantage of the data that they're already collecting in many cases, and kind of facilitate in a much more rapid way the type of work that we spent a few years conducting, so that locally there could be a much better understanding of how well budgeting at state and local health departments or other agencies engaged at the state level in adaptation, for example, how much that budgeting pays off in terms of reduced health harms, reduced burden on the healthcare system, reduced impacts on lost worker productivity, et cetera. So we're really interested in talking like actively right now with some state and local health departments, especially through the CDC brace states, to think about ways in which we can, facilitate this type of analyses, calculators, other tools, to kind of plug into their existing efforts, understanding that staff limitations are gigantic and continue to be a real obstacle, and thinking about ways in which we can make this more of a local story too.
Yeah, I wonder if the calculators do come to fruition, community needs assessments could maybe pick them up as well, since all the communities have to do a community needs assessment each year.
That's a great idea.
And just wondering the impact on Medicaid and Medicare. I mean, if your calculation is accurate, that 64% of the costs of the climate events that you were studying, the health costs were borne by our public coverage programs, that's just an astronomical impact.
Yeah, the Government Accountability Office and the Office of Management and Budget just in the past few months have drawn attention to the fiscal risks that we face at the federal level from climate change, including to CMS, Medicare and Medicaid. We have seen, I think, more interest from Dr. John Balbus at the Office of Climate Change and Health Equity at NIH in delving more deeply into this topic. We're also interested in working with some partners who have more kind of refined data on Medicare and Medicaid patient, loads. We are increasingly, I think, trying to talk about this climate problem as, even if you don't see yourself as one of the people, implicated in the types of health harms here, to a certain extent, as taxpayers, as folks living in this country, we're paying this climate tax already, right? So there's been a lot of scary messaging about how much the climate problem will take to deal with. But it's from my mind, like the climate tax that we're all pretty much paying at this point, right? It's a random tax, it's regressive, and that it's already afflicting the folks least able to pay, and it's a rising tax. Every day that we continue to see rising CO2 levels, we can pretty much definitively link that to more risk. So we try to kind of use the rhetoric and flip it on its head.
Thank you. Yeah, great ideas, and thank you for that. Is it Bob McClellan or Robert McClellan?
It seems like I answered to both.
All right, well then just go. Speak.
Well, I'd like to stay actually, but at any rate, so you've been talking about the public insurance, if you will. Insurance underwriters, certainly on the commercial side, are pretty sophisticated in their methodology to predict future costs, and obviously they underwrite premiums based on that. So are you aware whether or not life insurers or private health insurers are in the process of projecting the impact of climate change in terms of their rising premiums?
Right. Yeah. So we have talked with Kaiser Permanente and Blue Cross Blue Shield, and some of the other kind of players in the private insurance. We haven't talked to life insurance folks yet. My sense is that for heat-related mortality, there is some work happening on that front, but I don't think it's nearly as far along as I would have expected at this point. And there really does seem to be more interest in understanding, like you said, the effect on premiums and the effect specifically on folks expected to experience big increases in risk are oftentimes least able to pay. So thinking about how to model premium increases and distribute those. But like I said, even just since the study is published, we've had some of these insurers approach us, and I'm a little bit shocked that they're as far behind on this topic as they are.
If I can just say one other thing, the other insurers to be thinking about is workers' comp. It turns out that about 50% of heat-related deaths occur in new workers on the first day of work, actually, and 75% of all heat-related deaths in the workplace occur within the first week. And so I would think maybe workers' comp carriers who are really pretty sensitive, they do use 3-year rolling averages
Okay.
of costs. And so that would be another insurance group to talk to, particularly among those who insure outdoor workers.
Yeah, no, thank you for that suggestion. That's fantastic. And I'm just going to in the chat put a new tool that we published, I think just 2 weeks ago, to try to articulate the state of worker health protections across the country. Won't surprise you that we have a pretty patchy map when it comes, I'll put the actual map link in the chat. When it comes to worker protections, OSHA is finally taking interest in moving, at its unfortunately slow pace in worker heat protections, and we're trying to apply the pressure both at the federal and state levels on this front. So, but yeah, thanks for the workers comp idea. I've noted it, and it's a great one.
Well, we learned from the Supreme Court that OSHA can't protect against disease. So,
I know.
Deborah Klein-Walker. We can't hear you yet. There you
Okay,
go.
I had two things, but first, I was the one, having been in public health, I've done a lot with surveillance in states. And I just want to say to folks what I put in the chat. If you want to do this kind of thing in every state, you really have to get a big federal piece of legislation that gives that authority to CDC to fund every state, just like they do immunization. Some states will take it on with some of their state money, but certainly not a state like New Hampshire. And you're correct that our surveillance systems are a shambles. And as part of looking at the reconstruction, and I mean, we were doing a lot of soul searching in public health after COVID, and we really did have our pants down, but we've had them like that for a long time, and we need huge amounts of money into data infrastructure. And it's not going to happen at the state level. It's got to be federal and then go through.
Totally.
Okay, and that's after having worked in a neighboring state who has great surveillance and this one doesn't. So,
Okay.
but so just to advocate for that. The next thing would be, I really liked your idea about having different codes in medical records. And there are a set of codes that are around some of the social and economic things that a lot of people still don't use. So I was wondering, and we have a lot of docs here who would know, but I was wondering what reception you've gotten on that idea, because I think we need to push that kind of idea for a lot of other codes related to other things as well. And Medicaid and other people could potentially require them if we did that. But I don't know, we have Dr. Carl's on, Dr. Cooley, we have a number of docs here about what they think. I mean, I do think it's within the power of a state Medicaid agency to maybe ask for it, but I'm not sure. But maybe no one wants to say anything. I mean, I think that a lot of our research is limited because we only have the ICD-9 codes.
Right.
Right.
So, and we need them for a lot of things.
I'll respond as a recently retired family doctor. It's possible, in primary care, especially, there's such a workload issue that it would have to be really facilitated by developing the systems in what we're all using, which is the computerized medical record.
Right.
But if you reach for the tag and you click on it, and if it's in your menu, then yeah, why not? But it's got to get to the menu and to the top. You're not going to be looking it up on yourself. I promise you that. So if the systems, if the people that run the clinics can get behind this, absolutely it can happen.
Right. And agree on one medical record, right? No.
That's not going to happen.
I know. But it might start in different systems. Like if you could get a Kaiser or Intermountain or a Geisinger or something like that to do it, you'd have more data, which really be good. So that's another thing.
A Dartmouth Hitchcock,
Absolutely, that too.
The only thing I would add is that these are not called billing codes for no reason, and that doctors and practices and health systems are interested in the codes that bring income and not codes that are simply there for data purposes. And so there's an educational awareness piece, I guess, about that needs to happen.
It's just hard to assess what we don't really know. So the more we can do to know it.
One thing I can add from an epidemiologic perspective, and if you haven't guessed, my specialty is occupational and environmental medicine, is that certified EMRs in the next couple of years or so are going to require that there is coded industry and occupation by US Census codes, so that epidemiologists could, for example, look at medical records to see people who've died of heat illness, of what types of occupations do they have, or what industries. So there's going to be some, and that's going to be actually data that the primary care doc does not need to put in. It'll be patient entered, and there's some auto coding that will occur that will actually code it with the US Census code for occupation and industry. So it will be there for epidemiologic purposes, as well as treatment purposes, obviously, prevention purposes, and counseling purposes for climate-informed care.
Back to Carl's point about the billing codes, if you could get CMS, because of their financial interest in the whole problem involved, to put these codes as amplifiers to the existing level of care, then providers will start tripping over themselves to try to get that in their menu of their EMRs so that they can get amplified payment.
Yep.
Okay. Anyone else with a question? Vijay, if you were going to recommend to us that we read one thing to share with others, what would you tell us to do? Get on your blog and spread it around?
Yeah, that's probably where some of the fresher writing is. And we're continuing to try to remind everybody, you know, those IPCC, the second working group report came out at a kind of inopportune moment at the very end of February, and world events kind of overwhelmed that work. But we're continuing to point to that documentation of climate impacts and the focus on adaptation as a phenomenal resource. IPCC unfortunately doesn't do a great job of kind of the public communication side of their mission. And so we're increasingly trying to remind everybody about the resource and translate it for all sorts of audiences, including medical professionals.
So do you think we could take some of the data you have, it's more aggregate than just New Hampshire, and do something for New Hampshire to say this is the cost in New Hampshire? Have you done that for different states and tried to do that?
Yeah, we did that for Oregon and for wildfire smoke, because the governor's office kind of directed us to do that. But yeah, no, that would totally, it's totally like an open source thing to compile it. And the health costing data is all out there for the taking. So I'm happy to chat if anyone wants to take that on.
I think that could be an interesting one, and somebody had that in the chat that would really help us to try to figure out, you know, how to make some of the cases, because we are the only state who doesn't really have a comprehensive climate change law yet. No, we're hoping to change that in the next cycle, but so we could just contact you and maybe work on that.
Yeah, I'd be happy to talk.
Okay, well, this has been an incredible hour, and you've shared, if there are any other links you want to throw in the chat before we sign off, this has been incredibly helpful and inspiring, and thank you for your work, having at least a base level way to assess cost so we can talk about it in a trusted and legitimate way is really, really important. So we appreciate that. And great to have you here in New Hampshire virtually. Anything?
Will Dr. Limaye's slides be available?
Yeah, I'll send them your way.
Great.
Okay. Bob Friedlander, anything you want to say to end the evening?
Just a big thanks.
Great job, Lucy.
Terrific.
Great job, Lucy.
I've been tweeting. So everyone go to Vijay's Twitter feed, and then we'll find it all.
Yeah, I tweeted him, thank you too.
Awesome. Thanks
All
all
right.
of you. Have a good night.
Take care. Bye.
Mhm.